you. I'm going to tell a couple of stories. I think I was 11 years old. We live in High Wycombe, which is a small suburban town on the outskirts of London. And we live in a 1970s housing estate, kind of like the kind at the start of the Harry Potter movie. Red brick houses and neatly cut lawns, a very English middle class sensibility to the neighbourhood. My mum is a nurse. She went back to work after all of us kids were in school, and she is working a swing shift, so she'll be home tonight probably around 10 o'clock. Typically smelling of hospital antiseptic and instant coffee. And so that evening, it's just me and my dad at home. And I'm watching TV, and my dad says he's going to paint the dining room. Now, my dad is many things. He's a reader. He's a luminous thinker. He's a church pastor, so he can quote Martin Luther King and Martin Lloyd-Jones in the same breath, but he is not handy. He doesn't do DIY. So when he says he's going to paint the dining room, I should have known that something bad was about to happen. But I'm watching TV, and suddenly I hear from the dining room the scrape of a chair, a sudden thud, and then almost instantly after, the hollow splosh of emulsion paint hitting the carpet. And I jump up and rush to the threshold of the dining room to sort of survey this scene of chaos. There were no dust sheets, no covers on the carpet, and I don't still know exactly what happened, but my guess is he fell off the chair and the can of paint sort of flew out of his hand, because there's paint in a perfect sort of semicircular arc from one end of the dining room through into the kitchen. The carpet, the dining room table, in the far distance, the kitchen cabinets and the linoleum, everything is covered in emulsion paint. And I look up at my dad, and he takes a deep breath and then exhales, and under his breath he says, "Oh, I'm such a failure." And I'm 11 years old, but I want to help, right? So I jump to my feet and I start to help him clear up the mess. But we quickly realise that this is more than a two-man job. So we call my older sister. She lives down the road. And within about 5 minutes, my brother-in-law, who's also called Mike, arrives with a stack of old towels and some paint stripper. And by the time my mum gets home from work, almost all of the paint has been cleared up. You wouldn't know, to be honest, except for a faint stain on the green carpet, the walls, the dining room table, everything is like it was before. But somehow those words stick with me. So fast forward 25 years, it's 2013. I am living in southern Botswana in Gaborone with my wife. We'd arrived 2 years earlier with our 8-week-old daughter. And I am working as an HIV physician. I'm training doctors, I'm seeing patients in the outpatient department, and the work could not be more meaningful. Back then, 1 in 4 adults in Botswana is living with HIV, and the inpatient wards are completely overwhelmed with adults and children presenting with advanced AIDS. And the outpatient departments are full of people who are desperate to start on antiretroviral therapy. The work is exactly what I wanted to do. It really feels like I am doing the thing I was called to do, and the stakes feel big. But we're 10,000 miles away from friends and family. For any of you that have been to Gaborone, it's a podunk town in the middle of nowhere. It's hot all the time. And it was really hard. My wife hated it. But that particular morning, I get up. My routine is once a week, every Tuesday, I would drive to a district general hospital on the outskirts of Gaborone. I would give a lecture, and then I would see any sick patients in the inpatient ward that they wanted me to see. And then I'd spend the rest of my day working in the failure clinic, which is where folks who were failing antiretroviral therapy would be seen. And this particular Tuesday was no different from any other. I got up early before the sun rose. I drove out of Haberoni, and it's a beautiful scene. The sun is rising as I leave the outskirts of the city and drive southwest towards the South African border. And it's beautiful. This vast expanse of desert. There's the occasional baobab tree and acacia tree. There's lots of skinny cows, but otherwise it's just nothing, and it's outstandingly beautiful. And I arrive at the hospital just around 8 o'clock, just as things are about to get into gear, and you get that sense of busyness as the waiting area is already full of patients. I'm ushered into the doctor's mess, and I give a lecture. And then soon after that, the nurse in charge leads me to the inpatient ward. And there's nothing particularly unique about this inpatient ward. Many of you will know the scene. There are about 20 beds in a ward that's probably supposed to accommodate 10 beds. They're all stainless steel beds in rows, and it's stiflingly hot. There's no air conditioning, and there's a sort of a unique smell, a mix of blood and sweat and something sharper like antiseptic. There's a sharps container in the corner that is overfull, and there are flies hovering around it. And the nurse leads me over to the bed of a young woman. She can be no more than 22 or 23 years old. And the nurse explains that she'd been admitted 3 or 4 days earlier with profound anemia, newly diagnosed with HIV, and a history of a vaginal bleed. She'd been bleeding for about 2 or 3 months. I ask if anybody had examined her, and I'm told no, nobody had examined her. So in my best Setswana, which was pretty poor, I introduce myself and I ask if she'll let me examine her. We pull the curtains and I put on blue gloves. And then I begin my exam, and I'll spare the details of the exam, except to say that when it came to pelvic exam, the nurse who was assisting me handed me a speculum, and I tried to visualize the cervix. And I wasn't able to because there was a mass in the vaginal vault. And I couldn't see beyond it, so I asked for a small pair of forceps to try and remove the mass. And it must have been a clot, because in the process of trying to remove it, she started to bleed. And quickly, the lower spoon of the speculum filled up with blood, and she started to bleed quite profusely. So profusely, in fact, that I asked the nurse if she would check her blood pressure. It's 86 over 66, her pulse is about 120, and so I quickly asked, can we give her some IV fluids? And the nurse says, no, we're all out of IV fluids. How about blood? And by this point, there's a large pool of blood that's collected around her thighs and in the curvature of the mattress. And the nurse shakes her head and says, no, there's no blood. So I grab the woman's pillow, strip the pillowcase off the pillow, and push it up against her pelvis to try and dampen out the bleeding. By this stage, she's sweating profusely and slipping in and out of consciousness. I asked the nurse to check her blood pressure again. It's 66 over 45 by this point. And over the course of 3 or 4 minutes, I watch her bleed to death in front of us. And I stand at the end of the bed, and I just can't help but feel like I am such a fucking failure. It's funny how certain words echo through our lives, right? And I've often wondered whether that turn of phrase was inherited. Not in a genetic sense, but in the sense that some shadows pass from one generation to the next, right? And as I think about it across my whole career, I've often wondered, how so much of what I've done in my life feels like it's defined by failure. Not just the unsuccessful grants that I never got awarded, or even all the times I was traveling away from my kids, but in the sense that so much of what we do in global health is defined by failure. Global health in one respect really is like an apprenticeship in failure, right? We promise great things, but often fail to deliver. We propose bold visions, but then offer bureaucracy. And oftentimes there is a failure of imagination, there's a failure of political will, and there's often a failure of moral ambition. And perhaps for me, the biggest The sharpest failure is when all of those external failures are internalized and I allow them to define my sense of self-worth. A couple of years after that painting debacle, my mum and dad moved to another house, and I've never been back there. And I imagine that if we went back to that house in High Wycombe, it's probably been redecorated, remodelled, recarpeted a half dozen times. But if by some happenstance that carpet is still there, my guess is that there is still a small, faint stain there. Not as evidence of one man's incompetence, but as testimony to the fact that somebody tried. And I think that's true for global health too, right? Global health is not an exercise in perfection, it's a commitment to persistence. And my dad is not a failure, and I am not a failure. My dad is a man of grace and wisdom and moral ambition, and one day I hope to inherit that from him. Thank you.